Welcome to Damal Consult Career Academy. If you're preparing for your pediatric nurse interview with the NHS in 2025, you're in the right place. In this video, we'll walk you through the most common and important interview questions you can expect, along with detailed answers that will help you stand out and pass with confidence. Whether you're a newly qualified nurse or experienced healthcare professional, these tips and insights will boost your preparation and give you a competitive edge. So, let's dive in and get you ready to succeed in your NHS Paediatric Nurse interview. 1. Why did you choose pediatric nursing as your career? I chose pediatric nursing because I have a deep passion for working with children and supporting their health and well-being during some of the most vulnerable moments in their lives. I find it incredibly rewarding to help children and their families navigate health challenges with compassion, patience, and understanding. Children require specialized care that considers their physical, emotional, and developmental needs, and I am committed to providing that holistic support. Additionally, pediatric nursing allows me to make a meaningful difference early in a child's life, which can have lasting positive effects on their future health and happiness. This career aligns with my values of empathy, care, and advocacy for young patients. 2. How do you build rapport and trust with children and their families? Building rapport and trust with children and their families is essential in pediatric nursing because it helps reduce anxiety and creates a supportive environment for care. I start by approaching each child with warmth and a friendly attitude, using age-appropriate language and engaging in gentle conversation or play to make them feel comfortable. I listen actively to both the child and their family, showing empathy and understanding their concerns. I always explain procedures in a simple, honest way that the child and parents can understand, which helps build confidence and trust. Maintaining clear and consistent communication, being patient, and respecting the family's values and preferences are also key to establishing a strong, trusting relationship. 3. Describe a time when you had to handle a difficult or distressed child. How did you manage the situation? In my previous clinical placement, I cared for a young child who was extremely distressed and scared about receiving an injection. The child was crying loudly and refusing to cooperate, which was making the procedure difficult and stressful for both the child and the medical team. To manage the situation, I first took time to get down to the child's eye level and spoke softly to reassure them, using simple and comforting language appropriate for their age. I explained what was going to happen in a calm and gentle way, focusing on positive distractions. I also involved the parents, encouraging them to hold the child's hand and provide comfort. I used distraction techniques, such as engaging the child with a favorite toy and storytelling, to divert their attention from the procedure. This helped reduce their anxiety and made them more cooperative. Throughout the process, I maintained a calm and patient demeanor, which helped the child feel safe. By combining reassurance, distraction, and parental involvement, I was able to successfully help the child get through the injection with minimal distress. This experience taught me the importance of empathy, patience, and communication skills when working with children in challenging situations. Before we proceed further in this video, I want to share something that can really boost your chances of acing your pediatric nurse interview. If you're serious about landing that role, then you don't want to miss out on our exclusive ebook, 50 Pediatric Nurse Interview Questions and Answers. This guide is packed with carefully selected questions and detailed answers designed specifically for pediatric nursing interviews, helping you prepare confidently and stand out from the crowd. What's more, it's very affordable right now, because we have a special 70% discount running for a limited time. That means you get incredible value for a comprehensive resource that could make all the difference in your interview. Get it today for 70% off. For this week only, the first 20 people to download will get the ebook at an exclusive 70% discount. To get your copy, simply click on the sealer or fourth wall link in the description box below. Both platforms are easy to use, so just choose the one that suits you best. If you want to order directly, visit Sealer.co using the link in the description, or click the fourth wall link to complete your purchase. And if you have any questions or need assistance, don't hesitate to chat with our online customer care representative on WhatsApp or send us an email. Don't wait to long grab your copy today and take the next confident step toward seeing your pediatric nurse interview. 4. How do you ensure the safety and comfort of children during medical procedures? As a pediatric nurse, ensuring both safety and comfort during medical procedures is my top priority. I start by creating a calm and reassuring environment to help reduce the child's anxiety. This includes using age-appropriate language to explain the procedure in a way they can understand, so they know what to expect. I always follow strict infection control and safety protocols to prevent any risks during the procedure. I also use distraction techniques, such as toys, storytelling, or videos, to help divert the child's attention and make the experience less stressful. Additionally, I work closely with parents or caregivers, encouraging their presence and involvement, as their comfort and reassurance significantly help the child feel safe. I continuously monitor the child's physical and emotional responses throughout, adjusting my approach as needed to maintain their comfort and safety. 5. What experience do you have with administering medications to children? In my previous roles as a pediatric nurse, I have extensive experience administering medications to children of various ages, from infants to adolescents. I understand the importance of accurate dosage calculations based on weight and age, and I always follow the NHS guidelines and protocols to ensure safety. I take extra care to explain the process to both the child and their parents or guardians, in a calm and reassuring manner, to ease any fears or anxieties. Additionally, I double-check medication labels, monitor for any adverse reactions, and document everything meticulously. My focus is always on delivering medication safely and compassionately while maintaining clear communication with the healthcare team and family members. 6. How do you handle communication with parents who are anxious or upset about their child's condition? When communicating with parents who are anxious or upset about their child's condition, I believe that empathy and active listening are the most important starting points. I always take the time to listen carefully to their concerns without interrupting, giving them space to express their feelings fully. This helps parents feel validated and supported during what is often a very stressful and emotional time. I maintain a calm, compassionate, and reassuring tone throughout the conversation, which helps to create a sense of safety and trust. I make sure to explain the child's condition and treatment plan clearly and honestly, using simple, non-technical language that they can easily understand. This transparency helps to reduce uncertainty and confusion, which are common triggers for anxiety. I also encourage parents to ask questions and voice any worries they might have, addressing these patiently and thoroughly. If the situation requires, I involve other healthcare professionals like doctors, child psychologists, or social workers to provide comprehensive support tailored to the family's needs. Throughout the process, I focus on being both informative and emotionally supportive, recognizing that parents are partners in the child's care. My goal is to empower them with knowledge, ease their fears, and build a collaborative relationship that centers on the child's best interests. 7. Can you explain a situation where you worked effectively as part of a multidisciplinary team? In my previous role as a pediatric nurse, I was part of a multidisciplinary team, caring for a young child with complex medical needs who required coordinated care from doctors, physiotherapists, social workers, and dietitians. We held regular team meetings to discuss the child's progress and adjust the care plan as needed. My role involved closely monitoring the child's symptoms and communicating any changes promptly to the team. I also liaised with the family to ensure they understood the care plan and felt supported. By collaborating effectively, sharing information openly, and respecting each team member's expertise, we were able to provide holistic, patient-centered care that significantly improved the child's health outcomes. This experience reinforced the importance of teamwork and clear communication in delivering the best care possible. 8. How do you stay updated with pediatric nursing best practices and guidelines? I stay updated with pediatric nursing best practices and guidelines through a combination of continuous professional development and active engagement with current resources. I regularly attend relevant training sessions, workshops, and conferences to learn about the latest research and clinical techniques. I also subscribe to professional nursing journals and follow trusted healthcare organizations such as the Royal College of Nursing and NHS updates. Additionally, I participate in peer discussions and clinical supervision to share knowledge and reflect on my practice. This ongoing learning ensures that I provide the safest and most effective care for my young patients. 9. What would you do if you suspected child abuse or neglect? If I suspected child abuse or neglect, my first priority would be the safety and well-being of the child. I would carefully observe and document any signs or symptoms that raise concern, ensuring that my observations are factual and objective. I understand the importance of following the NHS safeguarding policies and procedures, so I would immediately report my concerns to the designated safeguarding lead or appropriate authority within the healthcare setting. I would also maintain confidentiality and act sensitively to protect the child's dignity, while ensuring that the matter is handled promptly and appropriately. Throughout the process, I would work collaboratively with the multidisciplinary team, including social workers and pediatricians, to ensure that the child receives the necessary support and protection. Ultimately, I believe that safeguarding children is a fundamental responsibility of every pediatric nurse, and I am committed to acting quickly and professionally whenever I have concerns. 10. How do you manage stress and emotional challenges in pediatric nursing? Working as a pediatric nurse can be emotionally demanding, as you're caring for vulnerable children and supporting their families during difficult times. To manage stress and emotional challenges, I focus on maintaining a healthy work-life balance. By engaging in activities outside of work that help me relax and recharge, such as exercise, hobbies, and spending time with loved ones. At work, I practice mindfulness and take short moments to pause and breathe deeply during busy shifts. I also believe in the importance of seeking support from colleagues and supervisors when needed, as sharing experiences and debriefing can be very helpful. Additionally, I stay committed to professional development, which gives me confidence in my skills and helps me feel better prepared for challenging situations. Ultimately, I remind myself that providing compassionate care makes a real difference, and that helps me stay motivated and resilient despite the emotional demands of the role. Do you have any question for us? Yes. Thank you for the opportunity. I'd like to know more about the support and development opportunities available for pediatric nurses within the NHS Trust, such as training programs or mentorship. Additionally, could you share some insights into the team dynamics and the typical patient caseload I might expect in this role? Thanks for watching. We hope these pediatric nurse interview questions and answers have helped you feel more confident and prepared for your NHS interview in 2025. Remember, practice makes perfect, so take time to review these answers and tailor them to your own experience and passion for pediatric nursing. Don't forget to subscribe to Damal Consult Career Academy for more interview tips, career advice, and support to help you land your dream healthcare job. Good luck. You've got this.